This next stitch is the subcuticular stitch, which is a stitch that I like to use because it closes the skin nice. You don't have to take this stitch out, which patients like. We generally will use an absorbable suture. We use 5/0 monocryl, works very well for this. And you don't have to take the stitch out. You still end up with a scar, but you don't have the track marks that you'll see with other scars. So cosmetically, it's a nicer stitch. You start out, you go, our incision's right here. We start out at one end, and the way I found is a good way to position yourself is parallel to the wound. And if you're left-handed, you start on the left side. If you're right-handed, you start on the right side. So you go in, again, 90 degrees, just like that. You come up with your needle, and you grab the needle. And on the other end of the stitch, you want to have a hemostat attached to it so it doesn't pull through. And then the assistant that you have will pull the suture out to one side. And then the place you want to go in is you want to go in just within the thickness of the skin. You're not going into the subcutaneous tissue, but it's actually in the actual thickness of the skin. And then you pull through, and the assistant will pull the suture first straight through, and then will pull out 90 degrees. And the assistant pulls out at 90 degrees because that's exactly where you want to go in with your next stitch. You want to go in directly across from that. So the assistant just has to pull it out enough so you can see where it's going to be, and you go through with your next stitch. And then the assistant pulls parallel to the wound to tighten it up, and then pulls out to the side. And then you get ready for your next stitch. And again, I'm trying to go right across from where that first one went in. And when I use my forceps, I'm grabbing the skin as little as possible. I'm using it more for direction. And that's where I find that the Atson Brown suture works well. And again, I'm looking to go in directly across from where I came out on the other side, just like that. And once you've done this for a bit, it becomes to the point where you can go through rather quick. And you just pull, when you pull it this way, you can see how it firms up the skin and closes it up. And then pull out to the side. And then I just move my skin edges up a little bit just so I can see where I want to be. And I kind of feel my way through with the needle until it bites down and come out. And then again, the critical part is that the assistant pulls out 90 degrees from the skin edge so you can see where you want to go in. And you just keep working your way right through. There you go, and you can see when he pulls it tight, it closes the edges right up. And after we're done this stitch, I'll always use steri strips just to reinforce it. And you can do this with a non-absorbable suture, which then you would have to pull through after 10 to 14 days. But I like to use monocryl, which actually will just absorb into the tissues. And then with the last one, I like to just come through right here, just like that. And that's the end of it.